Hano twakira abarwayi, mwanyuze hari imbere mwabonye aho twakirira abantu, aho twita kuri reception. Barabanza bagakorera umurwayi ifishi, bakareba ibyangombwa bye, bakamukorera ifishi. Hanyuma dufite ibyumba byo gusuzumiramo bitandukanye bigera kuri 16. Bagenda buri muganga uri mu cyumba bagenda bamuha abarwayi agomba kuza kureba. Hanyuma mu cyumba cy'umuganga harimo ibikoresho bibasha gufasha umuganga ku bizamini by'ibanze bishoboka, kuko dukora ibizamini bitandukanye. Hari ibikorerwa muri kiriya cyumba cy'umuganga, cyangwa byaba ngombwa ko yaba akeneye ibindi, dufite ibindi byumba dukoreramo ibyo bizamini bindi. Yego, mu cyumba cy'umuganga ubwo ndi kuvuga clinical officer, ophthalmic clinical officer, abashobora kwakiramo umurwayi, akareba uko umurwayi areba, akareba niba umurwayi akeneye amarinete, akareba ikibazo cy'uburwayi kiri mu jisho. Aho ngaho umurwayi ashobora kuharangiriza kwivuza, akeneye imiti, amarinete, nta kindi kibazo kidasanzwe afite gikeneye ikindi kizami kidasanzwe, arangiriza aho ngaho mu cyumba cy'umuganga. Hanyuma abaye akeneye ikindi kizamini kidasanzwe, hari uburyo bwabugenewe, hari impapuro ziyobora umurwayi amuha, bakamwereka n'aho akoresha icyo kizamini kindi. Hanyuma akaza kugaruka muganga akareba ibisubizo, hakaza gufatwa umwanzuro bitewe n'icyavuye mu bizami. Umunsi ku wundi twakira abarwayi batandukanye, ingeri zose, uhereye ku mwana mutoya wavutse, nimba ariko navuga, kuko hano twakira abana batoya cyane. Hari abana bavuka batagejeje igihe, n'urugero abo twita abaprematire. Abo bana ni umwana ubu wavutse munsi y'ibyumweru 32, ari munsi y'ikiro n'amagarama 500. By'umwihariko umwana wuzuje ibyo bintu uko ari 2 akenera kurebwa na muganga w'amaso, akora ikizamini cyo kureba mu ndiba y'ijisho, kuko mu ndiba y'ijisho naho aba yavutse hatuzuye neza. Bisaba rero ko muganga arebamo, akareba nimba nta kibazo kirimo. Nimba kirimo hagafatwa umwanzuro wo kumuvura bitewe n'ikibazo basanzemo. Rero twakira abana batoya, twakira ingeri zose, twakira kese zitandukanye z'uburwayi. Hari ababa bakeneye amarinete, hari ababa bakeneye imiti barwara ibyo twita amalerji, hari ababa bakeneye kozwa amaso cyangwa kuyabagwa bitewe n'ibyo ari byo. Aho harimo amashaza, harimo umuvuduko w'amazi menshi mu jisho, harimo abagira ikibazo ku ndiba y'ijisho, harimo abagira utubyimba, indwara zitandukanye, harimo abagira ikibazo cy'inzira z'amarira zazibye. Hari ibintu byinshi bitandukanye twakira aha ngaha.
Naje ku cyumweru ndanigabye, ndara ku muhungu wanjye utuye hano hakurya Bishenyi, buracya kugira ngo mpagere hano kare, kuko numvise ko haba hari abantu benshi. Mpageze baranyakira, barankorera, rwose ubu ndishimye. Ijisho ndareba neza, baranyereka inyuguti hariya nkayisoma, ubundi sinarebaga, ijisho ry'ibumoso ntabwo ryarebaga. Twaje saa 11, saa 11 n'igice twari tugeze hano, baratwakira. Nabaye wa 30, baranyakira, ariko ejo saa 8 bari bamaze kuntunganya kuri baga ijisho ry'ibumoso.
I'm an ophthalmologist and eye doctor, and I work since 15 years in Rwanda. And the last 5 years I work in Rwanda Charity Eye Hospital. And I'm living permanently in Rwanda. I enjoy very much working and living in Rwanda. And we concentrate on eye diseases. We do a lot of different surgeries and treatments. The main thing is cataract surgery, but we also do retina surgery, cornea surgery, glaucoma surgery, squint surgeries. We have a lot of patients with trauma, so we operate and try to help them. And we also help children with retinoblastoma. Retinoblastoma is a cancer in the eye, and we can treat it and heal it. If we treat it with chemotherapy, sometimes with surgeries, with laser, then we can save their eyes and their lives. So when I was studying medicine, I liked very much, I was very interested in ophthalmology, because it is an important field in medicine. It is a small field, but we can do a lot. And you see, you have surgery, you have consultations, And just by looking to the eye, you can already diagnose a lot of diseases. So normally you don't need much to make a diagnosis. And you help children, you help adults, young people, old people, women, men. So it's a field where you can be in touch with people of all ages.
Aya maso nta mwaka amfashe nyarwaye narivujeho nk'amezi 3 nari narahumye ntareba pe haza kuzamo rero ibintu binini by'ibishaza sindeba ubwo rongeye ku kigo nderabuzima basanga amaso yanjye yarandenze banyohereza nyine muri bino bitaro naje ntareba pe ubona ikintu kinini kigishaza mu jisho ariko bara iringiri niryo nabanje kwivuza hagezeho rero n'iringiri bampa randevu yaryo sinayirengeje pe nakurikije uko bamyoherezaga hano niko nakurikije imiti nkurikiza no kwivuza abaganga barankurikirana pe none ubu ndabareba.
So we started this new hospital 5 years ago in order to help all Rwandans and also people from abroad. But everybody, not only the richer people, but also people who have not enough money to go to normally to a private hospital. So it is a charity hospital because we treat everybody, so also people who have Mutuelle de Sante and who do not have private insurance. So first of all, it's open for everybody and we treat everybody, but we want to do very good medicine and good ophthalmology. We want to treat them well. So we try to do a quality eye, to give quality care to everybody. And we also give all the treatments in the field of ophthalmology. So it's from cataract surgery up to retina surgery, corneal surgery. We give a little bit of all the existing treatments. Just like if you would go to a hospital in Europe, we have the same machines, the same treatments, the same medication. So there's not much difference from our treatments with the treatments you get in Europe or in the US. Our population of patients reflects the population of Rwanda. So Rwanda has a very young population, so most of our patients are young. But some eye diseases are more frequent with older people, elderly people. So for some eye diseases, we see more elderly people. There are several challenges. I think one of the challenges we see every day is that still many people use traditional eye medicine. And for ophthalmology, for eye care, the traditional medicine is really not good because people put leaves and all types of things in the eyes which cause afterwards very bad infections. And some people lose their eyes, or afterwards we need to do very complicated treatments like corneal grafts to save the eye. And it could be prevented if people do not use the traditional medicine for the eyes. Perhaps for other diseases the traditional medicine can help, but for ophthalmology, for eyes, the traditional medicine is very dangerous. Another thing is that people, for example, who work in construction, they don't use protective glasses, protective goggles, and we see many accidents for people in construction, nails or stones or metal which enters the eyes and then perforates the eyes. So this would be good to start using protective goggles for people who are working in construction. So I think those things can help many people because we see so many accidents, so many infections which could be prevented. Also we see people who lose their eyes or have accidents because of traffic accidents. So those are all big challenges for many Rwandans who have accidents. Some people, they don't want to come to an ophthalmologist because they think it's very expensive, but it's not true. I think we give a very cheap treatment and good treatment for everybody who comes here, and we work with Mutuelle de Sante. So Mutuelle de Sante already pays 90% of the cost, so it's only 10% of the cost which is for the patient. So I think it is very affordable. Even if you compare with other African countries, you cannot never find a country where you get, for example, a phaco, which is a cataract surgery done in the way you do it in Europe, for 8,000 Rwandan francs. It's very cheap. And also the medicines are not expensive. So I think people should know that if you have Mutuelle de Sante, you have very affordable eye care. One of the challenges is that we have lots of patients and perhaps not enough staff members. And the profession which is not well represented, so is ophthalmologist, the doctor, the eye doctor. We have not enough eye doctors in Rwanda, but now the University of Rwanda is going to train new eye doctors. So in 4 years' time, they will start this year, and in 4 years' time, there will be new eye doctors, Rwandan doctors, who finish the training, and we will collaborate with this program to have more Rwandan doctors specialized in eye care available, and we hope that also some of them will work here, because we have not enough eye doctors in Rwanda. We work with the University of Rwanda. We are a practical training place for internships for the clinical officers. So ophthalmic clinical officers are trained. They have an A1 level training in consultation for eye care. So they can prescribe glasses, prescribe eye drops. They can make the diagnosis of all different eye diseases. And they also come here for their practical trainings. So we see here interns from the 2nd year and the 3rd year of ophthalmical clinical officers training. We do consultations, and our consultations, we do it from 7 in the morning up to 6 in the evening. But we are always open for people with emergencies, with accidents. They can come even after 6 o'clock in the evening, even in the weekends. We have an optical shop. We can make glasses here, all types of glasses. We do treatments like laser treatment. We give injections in the eye, and we give also surgeries, and we do different types of surgeries. The whole field of ophthalmology is represented. We do corneal transplants. We do cataract surgeries, glaucoma surgeries, squint surgeries, retina surgeries, orbital surgeries, eyelid surgeries. We do the whole field of ophthalmology. Otherwise, people who are admitted here, they can stay in a private room or they stay in the common ward. So people who want to have more privacy, they stay in a room for themselves. Other people can stay in the ward, the common ward. There's a restaurant in the hospital. Mutuelle de Sante covers here the accommodation in the common ward. But private health insurances, they pay for the private rooms also. So we have about 20 private rooms, and we are having more private rooms in 6 months' time, because we are expanding the hospital, and private health insurances, they reimburse the private rooms also. We have patients coming from Burundi or from Eastern Congo, from Goma and Bukavu, but we have also patients coming from Congo Brazzaville, for example, from Uganda, from Tanzania. There are patients from Sudan sometimes coming. So we receive quite on a weekly basis patients from far away who take a flight, very often with Rwandair, to come to get treatment for their eyes.
Inama twagira abantu ku bijyanye n'amaso, mu maso hazamo ibintu bitandukanye, ariko ibyiza nuko wegera muganga w'amaso. Ubu buvuzi bw'amaso bwateye imbere, ikintu cyose ubonye kidasanzwe mu jisho hashobora kuba ari ukutareba neza cyangwa se hajemo ikintu kidasanzwe. Ibyo bintu ni byiza ko muganga ari ugusobanurira ko ari ibintu biri aho bisanzwe cyangwa ari ikidasanzwe gikeneye gufashwa. Ntanze urugero nko ku bana, hari ababyeyi bakunda kubona abana bari muri salo bari kureba nka televiziyo, umwana akava mu bandi akirukanka akajya imbere ya televiziyo, cyangwa ukajya ubona umwana akajya areba ameze gutya ukagira ngo jya urambura neza, cyangwa umwana agatsindwa nko mu ishuri. Ibyo bintu akenshi ababyeyi hari igihe usanga babibonye akavuga, cyangwa umwana akamubwira mama ntago ndeba, cyangwa papa ntago ndeba, ariko umubyeyi akavuga ni ibyo umwana yigira. Oya, byiza musuzumisha umenye koko uwo mwana arareba. Yego, hanyuma abantu bakuru nabo icyo nabanje cyo kuvuga ngo icyo ubonye kidasanzwe wakwegera muganga akakurebera. Ikindi, hari uburwayi busigaye bufata umubiri nk'umuvuduko mwinshi w'amaraso, diabete. Ibyo bintu bishobora kwangiza amaso. Ntabwo ari itegeko ngo bite biyangiza, ariko bishobora kwangiza amaso. Inama nziza kuri abo bantu nuko byibura begera muganga w'amaso rimwe mu mezi 6, byaba gakeya akaba rimwe mu mwaka, akabarebera mu maso uko bimeze. Umuti wa mbere ujyana n'ibyo ni ugukurikiza amategeko ya muganga. Nimba ari umuvuduko ukaba uri kubipima muganga ashaka, nimba ari isukari nyinshi mu maraso ikaba igabanutse rwose, kugira ngo wirinde, hanyuma ukajya uyikoresha n'iryo suzuma muri icyo gihe cyabugenewe, kugira ngo muganga akurebere ko mu maso nta kibazo kirimo giturutse mu bundi burwayi buri mu mubiri.
So there is one type of eye cancer which is common in Rwanda, and it's called retinoblastoma. It is a cancer in young children, in babies and children up to 7 years. It starts like with a white spot in your eye or with squint, with the eyes which are not straight. And if untreated, if you don't treat it, then unfortunately the child will die. But if you treat it with chemotherapy and with an operation or with laser and with cryo, then very often we can save the eye and we can save the life of the child. So it's very important to come early enough, because if you detect the cancer and you treat it early, then you can save the eye easily and the life. But if you delay and you leave it and you see the white spot and you don't go to an eye doctor, then unfortunately the child can die. But most of the children we can save their lives, and we work with Butaro Hospital for what concerns the pathology. There's a very good pathologist, and we work with him to analyze the cancer, and but the chemotherapy is done here in the hospital. Yes. Yes. We have regularly new cases, and we have about 30 to 40 patients, 30 patients per year, new cases per year. So if a mother or a father, if they see a white spot in the eye of their child, they should immediately go to an eye doctor. Also, when they see that the eyes are not straight, if the child looks like this, with the eyes squinting to each other, or like this, the eyes are going outside, then they also should go to an eye doctor, because it can also be a sign of eye cancer. We choose Kamoni or Rwanda here because we could buy a big plot, and we needed a lot of space. In Kigali it would have been also very good, but it is more crowded and we could not find a big plot. And here finally it's not so far. It is only 12 kilometers from Kigali, and as we are expanding, we have enough space to expand. So we are happy about the space, because there are also already other eye hospitals and many private practices. There are already many eye doctors in Kigali. So here we are still with few eye doctors, and people who want to come from Kigali, they can easily come here. We rather expand here locally in Kamoni and not in other parts of Rwanda. But everybody is welcome, so from all the parts of Rwanda, people, it is easily accessible. We received a very nice road from the main road up to here. It's 1.5 kilometers, and it is thanks to His Excellency the President that this road was made. So 5 years ago, the President promised us the road, and After 6 months, the road was there. We are very grateful for this because it helps us a lot to be accessible. Now we are really accessible because it's a big tarmac road with even lights on it, and everybody can come here with a normal car. The buses stop at the market down at 1 kilometer from here, so we are quite accessible. The unique thing is, I think, is that we are accessible, that we work with Mutuelle de Sante, so it is for everybody, not only for a few people in the Rwandan society, so it's for rich and poor people. And I think we collaborate with other colleagues, it is unique because we give high quality services for everybody.